because Pete, just a sec,
All
we're
right.
still struggling with the connection.
It's Madikana presentee. All right. Okay,
Yes.
so Madikana is ready to give us a presentation from Limpopo.
Thank you. Thank you, Mr. Facilitator.
So this is not ready. I should move to.
Am I audible?
Thank you.
Am I audible?
Yes.
Okay. Thank you for the opportunity, Mr. Facilitator. And before we start, I would like to inform the workshop, the team, that I have my other colleagues present with me. It's Ms. Doris Matebula, she's our Chief Director, Ms. Joyce Mukobi, my director, and my colleague, Mr. Edward Malindi, as well as our learner, Ms. Mashinini. I would also like to appreciate the presentations that came before us. They were very informative, insightful as well. And I think we've learned a lot from their presentations. I'm trying to share. Are you able to see my slide? Are you able to see my slide?
Yes, we can, but please put it in presentation mode.
Okay. Is it fine?
Yes.
Thank you. We are from Limpopo. I'm Madikana Mokgokong from the Research and Development Unit. I think before we even zoom into the background, I won't dwell much on how the project came to be, because colleagues that came before me have already done that. I'm just going to zoom straight into our background and where we come from as a province as far as the inception of the project is concerned. When we started this project, we involved the universities of Limpopo, Venda, Tshwane University of Technology, the Polokwane campus, VUT, and the UNISA campus. We established a task team, which was inclusive of these aforementioned universities as well as government departments, with an aim of having a collaborative effort towards the realization of this particular project. The team therefore identified thematic areas as follows: health, social, governance, and economics. When we identified these particular themes, the idea behind it was that it should shape, or these themes should shape the manner in which the project will be conducted, as well as the reporting of the project thereof. We also collected secondary data from government departments and the Provincial Command Council, the PCC. The secondary data involved or included reports from departments, as well as the plans from the PCC and municipalities. Together with the team of the universities that I've already mentioned, we audited the secondary data. That auditing took place with an idea of trying to scrutinize and diagnose the potential challenges that we might face when we go to the field. And we discovered that there was a lot of missing data from the secondary data. Hence, we recommended that primary data collection should take place. It was anticipated that these aforementioned parties will be the key stakeholders of this project, and we had to adopt, or we wanted to initially adopt, both the qualitative and quantitative approach or methods. We wanted to zoom into the primary data collection that would involve key informants from the government sector, from the private sector, the business sector, the non-government, the non-profit organization, the non-government organizations, as well as civil societies. The idea behind this was that we wanted to get an in-depth understanding of what has taken place as far as the affected groups are concerned. We wanted to get a view or views and perceptions of the affected groups. For instance, we would have went to the field and speak to the business sector to try and understand how the COVID pandemic has affected their business operations, possibilities of retrenchment, if already the retrenchments had taken place, the number of jobs that have been lost. Also, maybe go to the taxi industry, try to establish how this pandemic has affected their operations. So that was the actual idea behind wanting to collect data from these different affected groups. We would have done an in-depth interview, administration of questionnaires and observation. For instance, to go to the field and see how your typical or your ordinary vendor has been affected by this particular pandemic. On the secondary data, we collected data from government departments such as Department of Education, Health, Local Economic Development, Environment and Tourism, Department of Water and Sanitation, COGSTA, which is the Department on Cooperative Governance, Human Settlement, and Traditional Affairs. We also got data from the PCC, as I've already mentioned. The report that we're going to present will capture measures adopted by departments, their challenges and successes thereof. It will also provide information on how government mobilized for community involvement, because community remains at the center of everything. They are the most affected groups. The aim and objective of the study, the aim of the report is to provide a bird's eye view on measures that were put in place to manage and control the virus in the province. The reason we are saying it's a bird's eye view is because it is generally on, or reliant on departmental reports and the PCC documents more than the primary data. The aim of the objectives is to establish measures adopted by the province to combat the spread of the virus, to establish successes and challenges faced by the province during the implementation process, and to reflect on the effectiveness or ineffectiveness of the measures developed and implemented. We had, limitations as far as the project is concerned and how we had anticipated that it should take shape. Unfortunately, what we had envisaged, a greater part of it did not take place due to budgetary constraints as far as primary data collection is concerned. So we could not collect data from the primary sources because of budgetary constraints. Therefore, the envisaged project could not take place as initially planned. Thus, the report is going to solely depend on the secondary data from departments and the PCC. Hence, you will, as and when we go through the report or the presentation, you will realize it's more inward looking because of lack of data, primary data. On the methodology, we have adopted a qualitative method. We've done document analysis, including the auditing of the secondary data that I've already alluded to. We had to analyze these documents so that we can draw an inference on how the province has responded to the pandemic. So in terms of the findings, we will go through the findings per theme and attach different role players that participated on each and every theme. The theme, the first theme is health. So in terms of health, what we have discovered when we were busy doing this analysis, we have discovered that medical equipments were procured amounting to about 54 million. Ventilators were allocated from small district hospitals to larger district and regional hospitals to manage COVID-related complications. The Department of Health also procured 50 high-flow nasal oxygen units for the clinical management of critically ill patients in different hospitals. And to augment for staff and manpower, the Department of Health had to, rapidly release an open advertisement of contract and permanent posts. To tackle issues relating to vulnerable groups such as the elderly and the sickly, the department adopted the following measures. The first one being that patients with chronic diseases were assessed on site, and those that were stable were given additional medications and repeat scripts. Those who were not stable were allowed to make follow-up visits. As far as maternal and child services issues are concerned, they remained open. Vaccinations continued, so did antenatal care. Patients who enrolled for centralized chronic medication dispensing, the CCMD, continued to collect their medication at designated points and external pickup points in retail stores such as your Clicks and your Discam and others. On community mobilization, the Provincial Department of Health, together with the DSD, developed a Limpopo Provincial Psychosocial Support Plan in order to publicly educate the community about COVID-19 through audiovisual media. Also, the psychoeducation was done on the inpatients as well. So the inpatients that remained in hospitals were educated on how to do social distancing, how to practice personal health and hygiene, such as washing of hands and sanitizing. The MEC of Health in the province regularly had health talks on radios from time to time to educate and conscientize the public on the seriousness of this particular pandemic and how they should remain vigilant. Regarding governance, various departments came forth and quarantine sites were prepared in collaboration with such departments. For instance, the Local Economic Development, Environment and Tourism Department and Public Works. About 46 quarantine sites were identified, and those quarantine sites collectively had about 4,777 beds, ranging from hotels, lodges, and camping sites. So these were the sites that were used for quarantine. There were challenges and successes along the way as we continued to implement these particular measures. In terms of the successes, the department has noticed that there were decanting of patients, which reduced the workload of the health workers significantly. And most facilities were recording less headcounts at emergency and outpatients departments. Most facilities were recording less headcount. There were decline in trauma-related injuries. Some of the challenges include the issue of unavailability of medicines, which owed to the global supply chain challenges because of the pandemic. Health services were scaled down in preparation of COVID-19 admissions. That's some of the programs or the services that are not related to COVID-19 were somehow affected. Health workers were also overloaded, with a lot of work as and when new cases came forth. So the health workers were overloaded with screening and testing for COVID-19, and it created a mental burnout and anxiety for the health workers. Because COVID-19 was a novel, or is a novel pandemic, there was no rapid diagnostic test available. So we solely relied on testing that was taking place in laboratory. Currently, the Department of Health has developed a resurgence plan, which was adopted for both second and third wave. It has been used for the second wave as well, and will be continuing as a plan that will take forward into the third wave as it is looming around. The aim of this particular plan is to reduce risk of COVID-19 resurgence. Moving to the second theme, social, we'll look into the aspect of social development and education. In terms of the Limpopo Department of Social Development, there were measures that were also put in place in the fight against the COVID-19 pandemic. The department established a departmental response team and psychosocial support team. The department also got to the length of identifying the needs of the department, such as observational facilities, and also provided psychosocial support for affected community members and bereaved families, working, together with the Department of Health. In terms of the Department of Education, the senior management team was established, and they had to look into how best the department can respond to the pandemic, and also, take into account the regulations and make sure that the measures are put in place and are implemented effectively. The disinfecting and sanitizing of schools took place, as well as screening of screening registers at schools, and that was enforced and adhered to. A rotational plan for all grades was developed and adhered to. Posters were also developed and shared with schools and communities in order to mobilize community involvement and community awareness on the COVID pandemic. There were weekly newsletters which were shared on social media platforms just to conscientize the public and how the department is responding to the pandemic. Psychosocial support was provided to affected and infected learners together with the Department of Health and the Department of Social Development. For the anticipated third wave, the department is in consultation currently with relevant stakeholders to remain vigilant, and there were guidelines specifically designed for the third wave to make sure that we become, conscientized as the province, and how then do we move forward. The department, I've already mentioned that it works together with the DSD and the Department of Health with the handling of positive cases in the province. Challenges faced by the Department of Development was that the non-governmental organizations and non-profit organizations experienced a great financial loss, during the pandemic, because the financial injections were no longer coming in. Support programs such as feeding schemes and drop-in centers were adversely affected by that. The issues of ECDs, especially in the disadvantaged communities, was very much a challenge for the department, because there were no longer funding that was coming forth, and it became very challenging for the ECDs to adhere and comply to the COVID regulations. Most of you would recall there was a court order regarding the ECDs reopening against the Minister of Social Development. That was also a challenge for us as the province, like other provinces. The Department of Education also had their own challenges, such as inappropriate infrastructure of the schools. Most of the schools in the province are not in good or do not have good infrastructures. So that became a challenge, especially when you look into schools that are overcrowded. There were issues around water and sanitation facilities. Some schools do not have water and sanitation facilities. So now when you speak of the issue of practicing personal health, and hygiene, it became a challenge for the schools to adhere to the COVID-19 regulations. The issue of shortages of professionals in terms of counseling at schools was also observed, although the province or the department roped in, the Department of Social Development for psychosocial support and psychoeducation support. The fact remains that most of our schools don't have counseling professionals. On the theme of governance, this theme encompasses the work that was done by different departments, such as Water and Sanitation, Cooperative Governance, COGSTA, and SALGA, as well as municipalities and water service authorities. So the Department of Water and Sanitation's approach towards the COVID-19 was directly, or was directed by the NCC on how to offer relief and combat potential rapid spread. Measures that were adopted by the department in response to the COVID pandemic include a response team that was set up to mainstream and consolidate water needs at the grassroots level in most of our rural communities. The CEO of the Limpopo Northern Water was roped in as part of the team, and he was charged with the implementation of with the responsibility of implementing the tasks. On community mobilization, communities were trained on proper washing of hands and other related hygiene protocols. And a comprehensive hygiene awareness program was rolled out to ensure that communities are aware of their responsibilities as far as personal health and hygiene is concerned. Hand sanitizers, face masks, bar soaps, and 20-liter water buckets were distributed or donated to communities to encourage them to practice personal health and hygiene, especially, the needy communities where some of this, might be a luxury. So the department had to, to come up with rapid measures on how they can be able to assist communities that are needy as far as, adhering to personal health and hygiene issues. Collaborations between the Department of Water Affairs, Lepelle Northern Water Service Authorities, COGSTA, and so forth, yielded positive results regarding the provision of water in communities and how community mobilization took shape. On the challenges, I think one of the challenges that remained with us for quite some time is the issue of water, the water service backlogs in rural communities. And this pandemic, more than anything, it has somehow, exposed, the service backlogs in rural communities, not only water services, but other services in large. So this water service backlogs in rural communities proved to be exponentially high, and thereby exposing communities to risks associated with lack of water services. For instance, if there is no water, we can't even begin to talk about the issue of washing of hands and all those things. So in Limpopo, a larger proportion of our population, about 85% resides in rural communities. And those communities are without water and other improved services. So the socioeconomic fabric of these communities remains in the periphery. And I think that is something that we have learned as the province. On thematic area 4, economics, the province has, through the Limpopo Economic Development, Environment and Tourism Department, has put forth measures in place such as an enforced strict compliance of national measures for the liquor affairs or liquor operators and taverns and other liquor outlets. Even the general business operations such as restaurants were also forced to comply with the national measures through SAPS monitoring systems. The gambling places in the province were also monitored by the gambling inspectors to ensure that they adhere to open hours regulations. Limpopo, as most of you might be aware, is one of the provinces that has a lot of tourism attraction. And this has affected the tourism economy. This pandemic has affected the tourism economy of the province, and the tourism sector had to come up with measures, or they had to come up with specific protocols to ensure compliance as and when the tourism economy was opening. Norms and standards for safe operations in the tourism sector were also developed and published to different stakeholders in the tourism economy. There was a provision of provincial tourism relief fund for the tourism sector. In terms of the challenges faced by the LEDAD department, was that there were possibility of non-compliance by some traders, and the department had to put in place mitigating plans, such as ensuring that SAPS and LEDAD officials have regular joint operations to enforce compliance to such non-compliant traders. Limited internal capacity to monitor compliance of tourism protocols and norms and standards was also observed, as well as inadequate funds to run tourism programs to enable the recovery of the tourism economy. So the department, with the province, we had to put in place and facilitate implementation of the tourism recovery plan that was developed. What worked well for us? I think other colleagues have already alluded to this fact. The collaboration. So from our side, we noticed that collaboration is important, although there will always be areas of improvement. But we have noticed that when sectors collaborated with each other, it became very easy to implement these programs, to ensure that they reach the intended beneficiaries. Collaborations remains the hallmark of integrated planning, and it helped us to facilitate, a coherent response mechanism, which helped to bring, together sectors from different areas and partners from different areas on how we respond to the COVID-19. I mean, the Department of Water Affairs, for instance, is a great example of how collaborating efforts can work for us as government. What do we need to do differently? Like I've already indicated, the pandemic has exposed a lot of challenges, in communities, in municipalities and the province as a whole. And I think even at a national level, we came to be more aware. I think it became a mirror for us to get to understand the extent in which our service backlogs are in most communities. And if anything, it has also somehow exacerbated this particular, inequalities that we continue to observe between, the rural provinces and the not so rural provinces. So we've noticed that access to services remains a challenge for us as planners, particularly, but for government as a whole. And we must begin to reform and improve on the implementation of our plans and our policies. We've also noticed that the delivery of water through trucks is unsustainable and risky, but necessary at that given period, because we're dealing with a pandemic that was rapidly, growing and becoming a surge and a scourge for a lot of communities. So we had to think on our feet and provide water tankers for communities. But the fact is, this remains unsustainable because it becomes risky. When people go to draw water at the tankers, they go there in numbers. The issue of social distancing is also compromised. We also think that government should take on a lead on service provision, especially at local government. But we are hopeful that through initiatives such as the district development model, which was launched in the province at the Waterberg district by the president, and also launched in different other districts by the premier, will yield good results. Importantly, it's the issue of coherent planning that is essential. These particular models and other plans need coherent planning. They also need integrated planning. So the issue of silo mentality, we have noted it, we have noticed it, and we think going forward it's something that we need to correct as government and begin to work collectively and integrate our efforts. The other challenge, as I've already indicated, that we had a problem or a challenge of finances when we wanted to conduct, a comprehensive full-scale study on this particular pandemic, is the issue of not being able to invest in research and development as the province, which is something that we need as the province to really introspect on and get to understand the importance and significance of research and development, and also investing in those efforts, collaborating together with the research community, universities, and the research councils. What we are recommending, firstly, in concluding remarks, is that this report is work in progress, and we're going to continue to amend it as and when data is available and arrives. We're waiting for data from other departments to come forth so we can beef up the report. And we are also exploring the possibility of conducting a full-scale research on this phenomenon when funding is available. And we are also pleading to prospective or potential funders that might be interested on doing the study in the province to come forth. They are welcome to collaborate with us as the province on how we can conduct a full-scale study. We're also recommending for the province to consider R&D investing in the research and development, even innovation, of the province, because for us to be able to get new results as the province, we need to start to begin and do things differently. And we can't do the same thing and expect different results. So we are also recommending for support as far as R&D funding and investment is concerned. And also the strengthening of research collaborations and partnerships in the province. we have universities. We have about 4 universities in the province: UNISA, UL, UNIVEN, and TUT, and other research communities that we have to begin to capitalize on such a research community and strengthen our research collaborations and partnerships so that they can yield better results for the province. Thank you. Well done, man. How do, am I, okay. I don't, okay. Thanks, Mr. Facilitator.
But before Tian comes in, I may have a question for you, Mr. Godfrey. Although some of these questions mostly are related to health, and you said you may not necessarily be in a position to answer health-related questions. The mental health, it's one of the things that now have come up.
Yes, it's quite an important issue. I think amongst the groups that are called the vulnerable groups, the people with mental health conditions are identified also in the main report of the in one of the chapters. I can't tell which one it is now, but it is highlighted somewhere. But what may be lacking is the level of detail around a focus on it.
Great.
So it will be useful if any of the provincial case studies, if they have zoomed into that particular aspect, it will be quite useful, because it's one of the issues that you'll find that they are at the domain of the health departments in the provinces. They can focus and zoom on it in the particular strategy of a province around it. It will be useful to get whoever wants to share around that information around that to be important.
Great. Thank you very much.